Hi, everybody joining this webinar for Vivive. My name is Mary Krempa. I'm one of the nurses at Bay Area Cosmetic Dermatology. I'm so excited that you're interested in this amazing procedure. And we're going to talk about not only Vivive, but we're also going to talk a little bit about EMsella and the different options that are available for stress urinary incontinence and female sexual health. And actually, there's a little bit kind of in there for male sexual health and stress incontinence too. So we're going to cover a few different subjects today. I'm so happy that you're here. And without further ado, we'll get started. And thank you guys for joining me. Thanks for chatting me up on the chat here. Appreciate that. Okay. Starting off, we have this gorgeous image that Vivive Solutions put towards us. And that's what we want our patients to feel. We want you guys to feel free, that you can do anything. You can jump on trampolines. You can do everything and live your best life. And I think this really exemplifies that, which I appreciate. Let's move on from there. Okay, so this is for people who are experiencing stress and urinary incontinence, but I'm not sure if you are somebody who experiences this, but do you, when you laugh really hard or you sneeze, that you pee just a little bit, or you jump on a trampoline or you go for a run and you just have a little bit of leakage. That's very typical for a lot of people. And or these other questions here: do you wear panty liners? Do tampons slip or not feel as snug? If you have any of these issues, then definitely maybe starting to consider some treatment might be the right decision for you. And these are questions that we'll probably be asking you if you come in and do a consult with us as well. Moving on to the next one. And this is just, like I mentioned, you are so not alone if you're experiencing symptoms. There's, like it shows on this slide, there's a really interesting statistics about this. So 33% of women, period, just altogether, 30% of all women, a third, experience urinary incontinence in their lifetime. And then I thought it was really interesting that over a quarter of female collegiate athletes who had children experience urinary incontinence. I think something that people always think that urinary incontinence is something that happens postmenopausal or just with having children, but actually it can happen to really anybody. And there's factors in there that I don't think science really fully understands yet either. But we have some amazing solutions to help, thank goodness. But you are definitely not alone. Okay, moving forward. Okay, so if you're experiencing this, you probably have felt this before, but how does this kind of stress urinary incontinence affect your life? It can really, everyone's different, but it can really make you feel like you can't enjoy yourself, like you're nervous to do your normal things, you're nervous to play with your children, you're nervous to let go and just relax and laugh and enjoy a good time. And there is a lot of association with being embarrassed or depression, with that. And I think it's one of those things where, I think a lot of, especially in previous generations, women just sort of live their life like this, and they didn't really get to fully express how they felt and get to really have a solution to make their lives better. So I'm gonna move on to the next one. Let's go a little deeper into the depression part. And it makes sense. If you're living with stress urinary incontinence, you really can live with a lot of shame and fear about having accidents or feeling embarrassed by it. And I think, all of us, none of us want to avoid hanging out with people we love or feeling like, we can't just attend social events, wear that fabulous dress that shows kind of everything and not feel embarrassed. I don't want anybody, and I think none of us want to feel isolated or lonely or anything like that. And, I think this can really help make people feel more confident. Also, another thing that people may not know about is that urine actually really messes with the quality of your skin, and actually having constant dampness or having just kind of that irritation over time really can break down your skin barrier, and it really cause some irritation, or even some skin degradation over time. A lot of people really do have urinary incontinence. You end up wearing sanitary pads, you end up doing barrier creams, and of course those are kind of band-aids for a larger problem, but there are some solutions that can help. But definitely, it's a little easier to just try to prevent it from happening at all and treat the underlying problem. But these are some things that can help. So here are some things, some treatment options that people have for tertiary incontinence in general. So definitely that's what we just talked about, is the incontinence routine care. And that's the, using absorbent pads, using barrier creams. And of course, if you maybe have mild, very, very mild incontinence, maybe that's enough. Maybe you just need to wear that with that specific outfit, or you're about to go on a run and that's enough for you. However, for a lot of people, it's just it's a lot. It's a lot to go through. Not really, obviously not mentioning the cost as well as doing that over time throughout your rest of your life. The other thing that's on the slide is the pelvic floor physical therapy, and the you should know this actually does really help over time, and it's a great prevention. But for a lot of people, this isn't enough to really have a huge difference in urinary incontinence. You can really practice your Kegels, and you can really do a lot to help. There's actually physical therapists and yoga instructors that even do more with this, which incredibly for a lot of people, it really does help a lot. But there are others that maybe you can't flex those muscles hard enough, or maybe that's not the only issue going on. Maybe there's some maybe changes maybe in the urinary structures, and maybe that's more in the areas around your urethra and your ureter in that area, and your ureter and all those areas there, that maybe you need something else to help with that as well. So and of course, the pelvic floor physical therapy, the downside of that is that it is quite the commitment. But with that said, I think everybody should be doing their Kegels. So if you're not doing that, maybe just do a couple right now. Just, go ahead. Just do a couple. It's going to be good. Okay, moving on. So the traditional treatments that have been done in the past for tertiary incontinence, really up until these treatments I'm talking about have really been invented, which has only been the last few years. Vaginal inserts. And basically it's a device basically you put in your vagina, and it basically pushes your urethra closed. And but the downside is you really have to take it in and out. To go to the restroom, it can cause some irritation. It can kind of build up odor. It's not very pleasant to do. However, it does work for a lot of people, and it's been kind of standby over time. There's definitely some invasive procedures that sometimes if people have really severe urinary incontinence, maybe that's their best option, of course, too. Or maybe somebody has prolapse, somebody needs a real surgical option sometimes. Bulking therapy is the big one. And you can kind of read through the slide here. It's basically, it's an outpatient procedure. They basically inject a gel around the urethra, and it basically helps support the urethra so you have more control. Kind of like the pessary works, except it doesn't close it off. It more supports the underlying structures and kind of keeps it open and keeps it more in your control. And it does help, but of course the limitations with that, as the slide says, is not everybody's a candidate. It is painful. You're undergoing surgery. There's a real recovery. Plus, in terms of how effective it is, it really depends on the surgery and how good a candidate you are. So it's kind of a lot of money and time to go through that. It works for some people really well, but maybe not every single person. Okay, so these are the ones that we offer in the practice, these two solutions. And what we love about both of them is they're non-surgical, they're safe, they're very easy to go through, and they're quite effective for treating stress urinary incontinence, as well as women's intimate health in general. So we'll kind of go more into that a bit, but to start off, we'll just talk a little bit about the two procedures. So we'll talk a lot more about Vivive, but just to kind of start talking about the difference between these two, Vivive is a radio frequency device that delivers a single session treatment to generate collagen, and kind of like, those treatments we're talking about, how they kind of support the urethra. That's how Vivive works. It builds up those tissues to support the urethra to give you more control. And also, what's nice about like all radio frequency procedures, I'm not sure if any of you guys listening out there have done thermage, for instance, but it's very similar in technology, and it basically like bulk heats that tissue of your vagina to build collagen and make those structures really work a lot better. And it's very safe. We'll talk about more, but there's no downtime. It's very easy. Okay, let's talk about EMsella. So EMsella uses what's called high FEM, which is high intensity focused electromagnetic currents, to really make your pelvic floor flex really, really hard. It'll do many, many contractions, like 10,000 per session. We're talking about really stronger than you can do on your own. That really makes your pelvic floor, which also helps support your urethra and helps you have control, really gets in there and builds that up. Both procedures, talked about bringing blood flow to the area. Both procedures actually do that, which is really interesting, which not only helps you heal, but helps your sexual health and your sensation and all that. Both procedures do that, which is kind of fun. And then you can see that, they look a little different, both procedures, and we'll kind of tell you a little bit more about what that looks like and what it's like to go through the procedures in a little bit. Okay, moving forward. Any questions yet? Okay, I'll keep an eye on it. Thanks, you guys, for participating. Okay, so let's talk a little bit more about EMsella, because most of this is going to be mostly about the Vivive today, but it's good to know the different things we have, and we really like to make these procedures work together to get you the best results. So EMsella, like we talked about, it uses those electromagnetic energy to really get in there and flex those muscles. And you can see from these pictures here, even though it's a little hard to see with these kind of ultrasound images, you can kind of see the bladder and the pelvic floor muscles. If you look at the white part at the bottom of that slide, that image, you look at either one, it's basically showing how thick and big the muscle is. And you can see that in the top one, basically that's prior to EMsella. You can see that it's kind of, it's not that strong, it's not that obvious. You look down below and you can really see that round, thick muscle. And that just shows you how much, and actually even the bladder looks like pushed up. It's not sagging down as much. That's what we're talking about with the pelvic floor strengthening, or just really helps build that up and support those structures to give you urinary continence and help with that. And going to the slide, definitely one session, you can even experience a difference, which is really fun. And it's immediate, the difference for some people. However, most people do need about 6 treatments to really see the full results. And some people really need a few treatments to feel the results from that. So everybody's a little different in that respect, but many people feel it right away, which is so exciting for those people. So good. And then moving kind of down there, it's kind of interesting. EMsella works both for men and women, which is pretty exciting. So since a pelvic floor, both men and women have a pelvic floor. A lot of people don't know this, but also men don't have as much urinary incontinence due to kind of life as women do. However, men also develop it, sometimes from prostate issues, sometimes from cancer, sometimes from other things, even from pelvic floor damage or pelvic floor relaxation over time. That's why men, if you're listening right now, do your Kegels too. It's not just for women, it's for everybody. Just do it. And tell your husbands and tell everybody, please. But it helps for both, and it basically works the same way for both men and women, which is very fun. And then also, actually, one more note about the male, what it helps with men, is that it actually can help with erectile dysfunction, and part of that is bringing the blood flow to the area, and with their sexual health. So it's kind of good for everybody. It's just good. And then in terms of what it's like to receive this procedure, so I talked about doing usually about 6 treatments, and our providers, we usually book you about 1 to 2 days a week, and we really just try to get you in there, kind of like a really nice physical therapy workout where we just get you in there, get those muscles going, and then after that, you can do some maintenance treatments either with, obviously at home, do your Kegels. Thank you. I'm going to keep on saying that a million times this session. Or, but also some people find that you may want to come in every 6 months. Some people maybe less, and just do one treatment just to kind of keep everything up and keep those muscles going. And actually in studies, EMsella has been shown to really keep that pelvic floor very strong. And their studies show really up to 6 months, sometimes even longer for some people. So it's very nice. It really helps. When you come in, you sit on a chair. I'm not sure if you take a look at that last slide, but you can see it's a really easy procedure. You take off your clothes. You can leave your panties on, which is kind of exciting, and just sit there, and we kind of position you where you kind of feel this kind of tapping on your vagina. And then once you're in position, we turn the machine on, and you can really feel those muscles really flexing. So it's very easy to do. And I've had it done myself. I kind of feel like it feels, sort of a combination of good and bad, if you know what I mean. Kind of intense, but kind of feels good at the same time. So it's really easy. Okay, next slide. Okay, we're moving on. I think that's about it for the Vivive. Yeah, that's about it. If you guys have any questions, of course, let me know. Okay, next slide. So what is the Vivive system? So I talked a little bit about it, but it uses cryogen-cooled monopolar radiofrequency, which is very similar to Thermage, to thicken that mucosa of your vagina, but also it penetrates quite deeply to help support the tissues of that whole pelvic area. It's easy, it's safe. I've had a couple people over the years feel like it can get hot in a couple spots, but actually almost everybody, it's like nothing. It's so easy to get done. No downtime. We recommend that you don't have vaginal sex for 48 hours after procedure. But besides that, we don't do anything. You might get a little spotting every once in a while. Some people report they have a little spotting right afterwards, but no big deal. And people feel really good afterwards. No anesthesia, super easy. You can kind of see, looking at these pictures, a little bit about how it affects the tissue. What they're trying to show you in this first kind of before treatment picture is that the collagen fibers can loosen up, and you see them kind of look far apart, not as meshed together and kind of as complex. And then as you kind of see, like, it's kind of cute, the little demographic during the treatment, how that shows that. Basically, it's showing the radiofrequency penetrating super deeply, which is good. And that actually, a little blue part of the picture, it's showing basically how the cryogen cools the outer layer of your mucosa, so to force that energy to penetrate deeper into your tissue. Okay, and then after that, the after treatment, you're seeing those cells look so much more complex and more integrated, and that's what we want to see post procedure. And this is something that's showing you it can take up to 6 months to see your final result. However, most women find that in about 3 to 4 months, you can see it, you can feel a difference, both in your stress urinary incontinence and also your sexual health. So what I recommend when I treat my patients is, set your calendar for about, just be on the safe side, just set it for 6 months in the future. Just, maybe it's like an anniversary coming up. Maybe it's, the holidays. Maybe it's a great vacation, post-COVID. Please, let's all go on vacation someday again. Maybe when that happens, maybe set your calendar to remind yourself, check in with yourself. How does it feel? Does sex feel different? Is your incontinence a little better? Are you able to just enjoy yourself without worry? Those are the kind of questions you should ask yourself for that time period. And people are very happy with that. So anyways, continuing. Okay, so again, the treatment takes about 45 minutes. Yes, it does take 45 minutes. Sometimes it does take a little longer. We do a little bit in the for some women to the labia, and that really helps kind of. I don't know if this happens to a lot of women, just so you know, but sometimes your labia can kind of lengthen as you grow older. You lose a little collagen, and it's not a big deal, but for some women that bothers them. And if it does, we can also do a little bit of the Vivive treatment on that part of your labia, and almost immediately, it's kind of cool. It shrinks it up a little bit, almost immediately builds that collagen, which is pretty fun. So it can take a little longer for that part of the treatment. And that part of the treatment's a little hotter, but it's doable, and people find it to be pretty easy. Okay, and no numbing cream required. Very easy that way. And just again, your body responds to the treatment by generating new and restoring existing collagen. Um, and then, this is that typically women feel the results in about 30 days. But, I think that depends. I think a lot of women, it really does take longer. So if you end up getting the procedure and you don't feel it right away, don't worry about it. It's going to happen. It'll just take time. So it's good. And it says sustained results document 12 months. So what they mean by that is after you feel those results, I remember when I went to my Vivive seminar, they talked about in their studies that it really lasts about 15 months total. So kind of like it takes about 6 months to feel the results. And then about 12 months after that is how long you can feel it. I do think in practice that really varies woman to woman. I do feel like I would say more it works at least 12 months. In studies, of course, they kind of, they'll study a certain amount of time and they'll kind of drop off. But I know some women that I've treated that it lasted quite a bit longer. They've been very happy. I do think with incontinence in particular, it's something that you have to keep up a little more than the sexual health part of it, just depending on what's happening. So if you do have a lot of incontinence or you have some issues, you may need to do possibly even 2 treatments. You may need to do 6 months apart to really get there, and then do maybe more maintenance than somebody else. So everybody's a little different with that. And of course, we're here to help you kind of determine how much we think you're going to need, and then also make a plan moving forward and to check in to make sure you have what you need. Okay, moving on. Thank you for staying with me here, guys. Appreciate it. Am I a good candidate for Vivive? So, of course, look at this. If you're over the age of 18, if you're experiencing any symptoms like urinary incontinence, talked about tampons, slipping or not fitting as snugly, leaking urine when you laugh, when you cough, sneeze, or work out, air passing from your vagina during exercise like yoga and spinning. That can happen. That's actually a really good thing to talk about. That can happen to a lot of women as things kind of change your vagina. So if you are experiencing that this really helps. And then 6 months post-delivery or 6 months post-nursing also. Something else I think that we're not mentioning here that I think is really important is I've definitely had a lot of women over the years that also, I don't know if you know this, and I'm not sure if you experienced this, but some women, when they go through menopause, there we go. Just checking my text stuff right here. You can actually lose a lot of sensitivity in your vagina, or it can start being painful during sex. And Vivive actually helps with both quite well. And I've seen that in many of my patients. One, in terms of having painful sex, it thickens that vaginal mucosa, which really, really helps with if you have like tearing or if your vaginal tissues are very thin, it can help like build that up and make it stronger and help with the pain part of it. Also, thickening that mucosa helps the lubrication of your vagina, which is so amazing that a device like this can do that. It's so cool. So anyways, that's kind of helps with that. And then in terms of losing sensation, a lot of that is blood flow. A lot of that is, again, not having your vagina as snug as it used to be. So it's not quite as experiencing the same sensations. Getting those things back, it can be life-changing for women. And I'm really proud that I can offer that and help women move forward their lives in a really amazing way. Okay. And then who is Vivive not a good option for? The big thing is an implantable electric device like a pacemaker, or as they talked about, an automatic implantable cardioverter defibrillator. If you don't know what that is, then you don't have it, and that's good. It's a good thing. But besides that, some things that we ask is, do you have any metal implants in your body? We do use a grounding pad for the device, but actually, depending on where the implant is, it's usually pretty safe to do it anyways. We just want to make sure we know where it is so that we're not in any conflict. But it's good for most people, but especially if you're experiencing changes. Okay, just checking any questions. Thanks, you guys, for joining me. Oh, great question. I just saw how often can you have the treatment? Thank you for asking. So you can do the Vivive treatment at the minimum amount of time is 6 months apart. That's what we see in our office. And I think clinically they do say you can probably do it early, like 3 months. But we like to have people wait 6 months just so they can see their final results. Just because maybe we can save you a buck and help you really, move forward with that. Um, and again, for some people, they need to repeat it every 6 months, or rather, at least a couple times to really get that sort of cumulative result to help you get the most out of the treatment. And then in terms of happening for most people, again, it's about every year and a half or every year, depending on what's going on with your body. Okay, and I got another question here. I just don't think I saw these before, so thanks for asking them. Um, are either treatments FDA approved? Thank you so much for asking. So Vivive is not FDA approved yet, but it's the only vaginal device of this kind, that's seeking their FDA approval for stress urinary incontinence. They're actually kind of in the later stages of that, so they've done a lot to do that. They actually, many, many countries in the world have their indication for sexual health, which is pretty exciting. In fact, I was talking to a nurse practitioner from Canada who was saying that actually the National Health Service system actually covers Vivive for female patients experiencing those vaginal changes. So it's pretty exciting. They're pretty good. EMsella, on the other hand, is FDA approved for both male and female stress urinary incontinence. So they're both really great, and they just work in different ways. And I'll talk a little bit later about how we can use them together too. Thanks for asking these questions. I really appreciate it. Moving forward. Awesome. Thank you. Okay, so perfect. What results should I expect? So, this says about Canada, the Vivive system is indicated for general surgery. See, that's what I was talking about. It's pretty fun. Okay, and it does talk a little bit about the In Control products here. Sorry, I'm just gonna go back to the slide. The Intone MV and Apex. These are a couple different home devices that exist that also help with kind of keeping your treatments up and help with urinary incontinence. They work a little differently. They're using LED lights, and I believe it definitely it helps with similar things. It can help with Kegel muscles. It can help with kind of the same way as the supportive tissue. We feel like definitely for the right person, that's amazing. The downsides, of course, is that you have to there's a bit of upkeep there. You got to really do it very consistently. And home devices are so amazing for some people. It's like they live maybe kind of in a rural area. They can't really get into do things very often. Maybe they do Vivive treatment and they buy something like this, and they really just great upkeep, and it helps so much over time. But for some people, it can be a little much. So, but I'm glad they included this so we can talk about all the options there is. So that's good. And then again, because it takes some time to really build those processes, it does take some time. So I think that's the gist of this slide. It takes some time to experience results. Okay, moving forward. And this couple are so cute dancing in the kitchen. I feel like I need to do that. All right. So what should I expect during the treatment? So you come in. We have you get undressed from the waist down. We have you put these really comfy, cozy socks that actually the Vivive company supplies for us, and they're really nice and toasty, and you'll feel really good for the treatment. And then I'll actually have an assistant help me during the treatment, and we'll sort of cover you, and then we'll use the Vivive. It's actually a probe that looks sort of like kind of like a Sonicare toothbrush without the bristles, but it's small. It's kind of like a small tampon size, and we insert that in your vagina, and it takes about 45 minutes, but we basically, not to go into too much detail, but we basically go in different depths of your vagina and do circles, kind of like a clock on your vagina's pulses, or your vaginal canal rather, to sort of do the different areas there. Some practices, just so you know, they kind of will split up the areas and have you basically just do maybe some pulses at the very deepest part, just for the stress urinary incontinence. We like to just have you do your whole vagina, because it just helps with everything so much. Again, the sexual health, anti-aging in general, plus the stress urinary incontinence. And even if you're not experiencing stress urinary incontinence, maybe you're just doing this for your vaginal health and your sexual health, we'll definitely do the stress urinary incontinence part too, because it really helps keep everything up. And nobody wants to develop that. You just want to age in a great way and just keep on feeling good. So there we go. So if there's anything else I haven't talked about already. Yeah, and it kind of feels, oh, this is a good point. Patients do feel kind of a combination of cold and warm at the same time. Like, because with that cryogen cooling I was talking about, sometimes the first sensation is actually cold. And then you might feel a little warmth as we go, a little heat. And I do think sometimes people will feel a little spike of heat every once in a while, but I actually think that's on the rarer side. But every once in a while, a patient will tell me that. So, but usually very easy to do. Okay, moving forward. Thank you so much. Okay. Okay, so this is important to talk about. It really is a different, results do vary from woman to woman. A lot of that has to do with what's going on with your body. How bad is your incontinence? What's going on with your vaginal tissue? Do we have maybe you're somebody who, maybe through hormones, maybe through pregnancies, maybe through life, maybe you were a marathon runner your whole life and you developed some differences in your tissues, or maybe some more severe than others, which obviously exercise should not be avoided because it's amazing. But, for someone that can be a factor, as we learned earlier. What we recommend is, again, kind of talking about it with you, seeing, what kind of feels right, what makes sense, and, really treating as we go. So like we talked about, doing one treatment, waiting 6 months, seeing how it goes, seeing how you feel, and then see what you do from there. And actually on this slide, I think it's a good time to talk about how we combine the EMsella and the Vivive treatments. So as you guys have probably seen already, they really do two different things. However, they work together to get the best results. So, the Vivive helps with, especially stress and urinary incontinence, but for both. So the Vivive helps, right, get the tissues, kind of build that collagen, build those structures. And then the EMsella works by building that muscle to help support those structures as well. So we're building structures in two different ways. Because we really believe in this treatment, and especially these two treatments together, we offer the Vivive treatment, and then we actually offer 3 free EMsella treatments to go along with it. And that just really helps everything work better. Excuse me, helps the blood flow to the area. And what's fun with these treatments, you can do them both the same day. You don't have to space them apart. So it's very, very easy. And for some women, they find, actually another thing to mention, they find that they'll do the Vivive treatment and maybe, they themselves, it's less expensive. And actually on that note, this is a great question I just got, but I'll talk about prices on both of those and how they differ. But the EMsella is, really easy to go through. It's very non-invasive. Plus, it's a little bit less expensive, and you can kind of do some upkeep. Like maybe, for instance, 6 months later, you just want to do a little, touch up with the EMsella. It's very easy to come in and do that. Okay, I'm gonna answer this question. I'm gonna talk about prices next. So I just was asked, how soon after the Vivive can you begin the EMsella treatments? So I think I just answered that, but basically you can do it immediately, which is really exciting. And especially because it's going to take some months to feel those results, it's kind of fun to come in and do something where you really feel something immediately. So yeah, thanks for asking that question. Let's talk a little bit. In fact, I'm going to go back to that slide comparing the two of them, just so I can talk about the prices, and then I can move on to the last couple of slides, just because I know that's a big question for most people. Okay, so the Vivive treatments, that lovely Vivive, we charge $3,400. And again, we do include 3 free EMsella treatments with it. And just because we feel like they work so well together. The EMsella treatment on its own, let's say that you're somebody who maybe it's just a pelvic floor issue. Maybe, for instance, for you, you have less stress urinary incontinence, but you have urge incontinence. I don't think I've gone over yet, but that's basically where you really feel like you have to go to the bathroom really, really bad all of a sudden, and it's like you can't hold it, and it feels like it comes on like a freight train, and you just got to run over there. The EMsella works much better for that type of incontinence, and part of that just shows you that it is sort of a deeper pelvic floor issue. So if you have that, we'll probably just recommend EMsella, or maybe you're a man who has some incontinence, we'll probably just recommend EMsella. But for a lot of women, depending on how the severity of stress urinary incontinence, most people probably need to do both over time, and we'll recommend that. Okay, moving back over. Oh, I don't think I said the price. It's $280 to EMsella. So $280 for the EMsella, and then the Vivive is $3,400. But it's a little bit more of a treatment, lasts a little bit longer. plus you get the 3 free EMsellas. So, okay, we're going to move on to the last couple slides here. Thanks for staying with me, and thank you so much for your questions. I really appreciate it. They're really good. Okay, let's see. All right. Okay. Oh, and this is kind of fun for the last part of the slide. We believe in Vivive. It really is. There's a lot of treatments on the market, and Dr. Welsh chose this treatment. Our practice chose this treatment because out of all the treatments we demoed and we researched, this one's the one that when you look at the FDA approved studies, it's so safe. I guess not FDA approved, it's on the approval, but rather the FDA approval studies they're submitting, it's so safe. There's really no side effects. We actually look, just so you know, anybody who's watching, we actually look every month at the FDA website called MAUD, M-A-U-D, for all of the side effects are reported every single month from all the devices we do. And I look every single month at the Vivive reported side effects, and it is extremely low to nothing. So we really love it. We really love that it's so safe and so good. Proven results, definitely. It's really fun to have something that works. We love it. And then quick and easy, not a big deal to go through. Again, not surgery, no downtime, really easy. And then lasting effects, it lasts quite a bit of time. And again, everybody's a little different, but it does last a long time for a lot of people. Okay, moving on. All right. These are some quotes from this is actually from Vivive, these quotes, but I like these a lot. I've told all my girlfriends about the Vivive treatment. The procedure was very easy with the initial benefits apparent. Within a month after the procedure, I can't tell you how many referrals I get from women who are like, oh my God, I have to tell my girlfriends, this has changed my life. And thank God, as women, we're talking to our girlfriends about this now. So thank you. But it's a home run for a lot of people. And, talking about the sexual health, kind of your partner, I've heard that. One of my really good friends, who's just a little bit older than me, but, absolutely fabulous. She had this treatment done for the sexual health. And she was like, she didn't tell her husband, he kind of was like, whoa, things have changed. And for her, things felt a little different too. And it was very positive. They both were really excited. So it's pretty fun. Yeah. And just like we talked about, it's painless, easy, and it's really fun to see that. I like that. Okay. And then warnings, precautions, always good to go through. But, if you're pregnant, you can't do this. If you're trying to get pregnant, you shouldn't. What's the point? Everything's going to change in a second. You might as well just wait. Breastfeeding or been breastfeeding in the past 6 months. Again, like things change and breastfeeding helps with some hormone stuff. You might as well just kind of let that all settle out before we start. You should probably do this if you're doing chemotherapy or radiation therapy. You're not going to have the same collagen building results. So just leave it alone. No worries there. If you have any open lesions or any sexually transmitted infections, that's just a good thing to do in general when you're working with your vagina. Just make sure you leave off until you've treated those things and you come back and you can see us. But, it's fine. Just wait a little longer. Again, any male implants we talked about, it's not a deal breaker. It just depends on where it is. So we'll talk about that in your consultation or even on the treatment day and figure out what that makes sense there. A medical condition that you're taking a medication. So it's interesting. This is a very interesting point. I understand why Vivive included this in the slide, but it's a little bit of a gray area in our cosmetic field, whether taking NSAIDs, like over-the-counter, ibuprofen, aspirin, things like that really affect collagen building results. We do many procedures in this office, and sometimes we do recommend you take ibuprofen beforehand, so it helps the inflammation afterwards, and we don't see a huge difference with that. I think that, just to be on the safe side, definitely taking steroids, that actually does interfere with it, so don't do that. But let's just say like you have a terrible migraine condition and you take your migraine medication, it's probably a good idea to take some Tylenol if you want to be on the safe side as opposed to these other ones, because it doesn't do as much anti-inflammation. However, if ibuprofen is the only thing that works, you know what? It's not the end of the world. You're still going to get collagen building. It's still going to work, but there's some evidence to show that may not work as well. So again, we'll talk about that during the consultation, and also you should let us know if you took something so we can know what to expect. And it's always good that if you get a procedure done with us or anybody, tell your doctor, tell your providers what you're using. That's really important. So just let us know. Okay. And then of course, if you have a chronic vaginal vulvar medical condition, we should know about it so we can best help you. And on that note, if you have any prolapse, let us know. Sometimes you can see it during the treatment. It's interesting, depending on the severity of the prolapse, we can actually still treat, which is kind of exciting. But if it's bad, of course, we can't. And at that point, we might recommend more surgical options or things that we can't do in our office. But for a mild prolapse, absolutely. It can really, really help a lot with strengthening those structures. And then, of course, you're allergic to any specific component. But, I really haven't had anybody be allergic to anything. It's a water-based gel lubricant that we use. And then the device itself, it's basically like metal with like some plastic. So it just depends on if you have really severely allergic to those kind of materials. But I'm sure it'll be fine. Okay. And then again, if you have an implantable electric device, this is not for you. So you'll probably have to go do surgery or something else, but that's okay. There's other options. Okay. And then, what are our patients? These are some really fun reviews from our little Bay Area Cosmetic Dermatology patients ourselves. And you can kind of see that this first one, I really like this one. After having 2 children and before EMsella, I could literally not run. Each time I tried, I would literally wet my pants. That's rough, My OB-GYN suggested surgery, but I thought I'd give EMsella a try. After 6 sessions, I am dry as a bone after running. I can even do jumping jacks without embarrassing leakage. My sex life has also improved. And I love that. We're grateful to you, RS, for coming and seeing us. And I'm so glad it helps. That makes our job so great when we hear that. Thank you. Okay, review from KW. Oh, this is cute. After 2 treatments, I flew to Miami and danced for 3 hours to a salsa wedding band. Well, if anything's going to trigger stress incontinence, that's going to be it. I've been incontinent for 21 years since the birth of my son. And EMsella helped turn back the clock to a life where I'm not wondering where the nearest bathroom is. The treatment takes 28 minutes. Oh, yeah, you know this already. Oh, by the way, I didn't mention that. EMsella takes 20 minutes. It's very easy. I didn't mention that, but it's very easy. That's really makes me happy. Okay, review from Anonymous. After multiple vaginal births and an active lifestyle, I thought it couldn't hurt to try Vivive. Totally. Why not just try it? It's so easy to do. I was told to expect improvements in laxity, lubrication, and incontinence. The procedure was only uncomfortable in that you're letting somebody treat your vaginal area. Yes, that might be the most uncomfortable part. But just so you know, maybe this might make you feel better if you're on the fence because of that reason. Me and our physician assistant, Cynthia, perform this treatment, and we literally do them all the time. That's our jobs. And we are so grateful to be able to treat women and help them feel better. It's no big deal. And we just want you to live your best life. So just know that going into it. Okay, anyways, let's go back to the quote here. Once your mind gets over that, yes, the procedure is easy and I did not experience any significant discomfort. I first noticed an improvement with incontinence. Vigorous exercise or just laughing too hard doesn't cause wet pants anymore. That's great. And then increased sexual pleasure detectable by both my partner and myself. Yeah, it's pretty amazing. I know. Yep, I love hearing that. And then lastly, another one of our patients, another anonymous. I'm very happy with the treatment. My urgency has decreased. I currently do not need to use the underpant lining. I can not use the toilet for the duration of the flight. Oh, New York and Chicago. Very good. I like hearing that. And it sounds like she usually had used the facilities a couple times. So that's huge. And I usually mention this. We only mentioned about how it can affect your sleep. I guess sleep, you're probably pretty relaxed during stress incontinence. However, urgent incontinence, if you experience that, it can help your sleep if you get this done as well. Wonderful. Well, I believe that is it for our presentation. Again, I'm going to look for some questions. I don't think I saw any other questions, but we'll just kind of hold off for a second in case there's any questions that come up. But again, I know I speak for myself, but I know Cynthia feels the same way. Our PA who does this treatment as well, is beyond a pleasure that we get to help women with this aspect of their lives. I think of this all the time that only a generation ago, women didn't talk about their incontinence. Women didn't talk about that sex changed as they grew older. Nobody even talked about sex or expected older women to have sex. And now, or women after they give birth to have sex, or even care about the female sexual experience. But now we really talk about it, and we just want you, and I want to live my best life. I want all women to live their best life. Oh, I saw a question. Thank you. Oh, and thank you. Right back at you. I got a question. How long are you in the office for an EMsella? Great question. So the procedure takes about 28 minutes to actually do, but because the positioning and getting you undressed and getting you kind of set up afterwards, expect to be here for about, I think we book our appointments for an hour, but really you'll probably be here about 45 minutes total. Yeah, that was a really good question. And then of course the Vivive, even though it's about a 45-minute, treatment, expect to be here for about an hour and 20 minutes. I think for everything we do, we just want to make sure you're really comfortable. We discuss everything. We make sure that we're all on the same page. We give the best treatment possible. So make sure you're ready for that. Oh, and I just saw, it was really cute, a comment. Viva, the female sexual experience. Thank you. Well, thank you, because I'm excited that you're interested, and you're interested, that you're like me, that we just want us all to live better lives. So I so appreciate all of you guys joining me. This has been so much fun to talk about something I really love and I'm passionate about. And if you have any questions that come up, we're gonna be posting this on our website.